My name is Kara. I am doing my presentation on the muscular system. So, muscular system, we'll start with the structure. Has 3 different basic types of muscles. That's going to be skeletal, smooth, and cardiac muscle. So cool thing about those is, so your skeletal muscles, those are basically going to be there for your structural support and your providing your movement, things like this, being able to raise your arm up and down, side to side, things like that. Smooth muscle, those are the muscle that lines a lot of your interior organs and things like that, as well as your blood vessels, so it will assist with pumping blood. It will assist with moving the nutrients from your stomach through your intestines and out through your bowels, things like that. It also lines your bladder, so when you have to pee and those muscles contract to help you release that. That's your smooth muscle. Lastly is the cardiac muscle. Cardiac muscle is just going to be the muscle in your heart. So that's going to be the muscles that line the walls of the ventricles and the atrium that cause the pumping motion to occur. So that basically covers all of those functions along with that. Skeletal muscle is voluntary, so you control that motion. I am controlling the motion of my hands. But smooth muscle and cardiac muscle are going to be involuntary movements. So that means that you cannot control the motion of the food through your system. You can't control your heart in pumping its blood, things like that. Some risk factors that can cause disorders or diseases of the muscular system are going to be a lack of physical activity. That's the most common. So if you don't use them, you're going to lose them. Things like poor diet and smoking can also contribute to some muscle loss or disorders and diseases of the muscular system, just by allowing you're missing out on those specific nutrients that you need to cause your muscles to move the way they need to. Injury and overuse, that's pretty self-explanatory. If you heard it, it might not work the same as it used to, or it won't work the same again, things like that. Genetic disorders, that applies to specific kinds of disorders like muscular dystrophy, that's specifically hereditary. Specific genetic disorders can cause your muscles to have problems as well. Infection and inflammation, some certain cancers and certain medications are also some risk factors that can cause diseases or disorders of your muscular system as well. Age-related changes, so most of your age-related changes are going to be due to disuse. So that's going to be primarily with that lack of physical activity. Again, if you don't use it, you're going to lose it. So, that can cause things like atrophy. Also, loss of muscle tone and muscle strength. Those are other things that are more common with age-related changes. So again, you're going to lose your muscle tone and muscle strength as you get older naturally. The tissues that usually would repair and replace your muscles, or replacing your fibers with a more stiff and fibrous, kind of harder to move tissue instead of your typical muscle tissue that you would have replacing as you're younger. So when things like injury or inflammation and things like that occur, when your body needs to replace those tissues as you get older, it's going to become more rigid and harder to move those tissues because of how stiff they can be. So certain disorders that are part of the muscular system, the 3 most common ones, muscular dystrophy, like I said, that one's hereditary. It is going to be more of a genetic factor that causes the dystrophy to occur. Most muscular dystrophy has, the symptoms will be based on the spectrum of how severe it is. It's kind of more of like the severity. So some people have an easier time with the dystrophy and some people have a harder time with it. But it basically just causes a loss of muscle tone, loss of strength. A lot of people will end up with a lack of ability to walk. They'll lose that ability to be able to walk in muscular dystrophy. Another type of disorder is cardiomyopathy. This isn't necessarily pertaining to your whole body, but this is specific to the heart. So this is a normal heart right here. The muscle is this light orange part. This is all very, it's more elastic, it's thinner, it's not as stiff when you're younger. With cardiomyopathy, it affects these muscles and causes them to become abnormally large or stiff or just, what's the word? Thick, abnormally thick. That's what I was looking for. And that can cause a number of different problems where the muscle doesn't function as good as it should, and so your heart doesn't pump blood as efficiently as it can. There's less space in these ventricles, that so there is not going to be as much blood flow allowed, and there's not going to be as much blood pumped through each beat of your heart, and so that can cause some overall cardiac health issues. And lastly, as specific as a geriatric muscular disease is known as sarcopenia. It's basically characterized by a loss of strength, tone, mass of your muscles. A lot of these is characterized from a lot of disuse. You can provide rehabilitative measures to reverse sarcopenia. And where you can, where exercising, range of motion activities, things like that can help promote the strength of the muscles to regain themselves. Not to its full potential, of course, but just to the point where they can support themselves or they can move freely without pain or discomfort. Some things that the CNA should know when caring with somebody with any of these disorders or having a high risk factors or any of these age-related changes to the muscular system. So the resident or person requiring care is not going to be able to support themselves as well as they might be able to in things like sarcopenia and muscular dystrophy, things like that. And so the CNA is going to want to know that they're going to need more support. They're going to need more time. They're going to need more, maybe more assistance to get around. And so they should know to just go slow and take their time with them. Secondly, a CNA should know that that exercise and daily activity is super important in maintaining and preserving the health of the muscular system as well as rehabilitative measures. So providing those range of motion exercises, allowing the resident to do that themselves, or providing passive range of motion is very important in making sure that the muscular system is taken care of and that these disorders are sort of not necessarily prevented, but maintained. And then lastly, the person with them having these types of muscular disorders or these risk factors, age-related causes, are not going to be able to move as quickly as they used to be able to. Their muscles are going to be stiffer. They're not going to be as flexible, so it's going to be harder for them to move around as efficiently as we do. And so the CNA is also going to want to remember to take their time, let the resident or person requiring care do the things at their own pace that they need to make sure that their muscular system is taken care of. Thank you for your time.